Buenas tardes a todos, todas.
Good afternoon, everyone. I'm very pleased to be here next to Nicolas and Florencia, and very happy to share with you all lots of friendly faces. I've been at the bank for such a long time. If I haven't met you, it's because you're too young. So this is what we're here for, the book, The Science of Details. Unfortunately, we don't have a free copy for each one of you, but if you'd like to pay it for a modicum, you might get it. I'm Carlos Scartascini. I lead the behavioral economics group. I'm in the research department. So there must be some reason why they seat me here in the middle. And as I was saying, it's a great pleasure. The conversation will be in Spanish for those of you on Zoom.
Like a world button or something. Pasé al inglés porque siempre decimos, para aquellos que quieren en inglés y les damos las instrucciones en español.
I switched to English because otherwise it sounds a bit awkward. Anyway, I've talked for too long, so we're going to start off with a video. Fernando Regalia can't join us, unfortunately, but he's left us a video which we'll share with you. Good afternoon. My apologies for not being able to be with you. Still, I wanted to present the Science of Details. The book is a valuable tool to enhance our projects. It combines economic knowledge with the practical experience of those who work in the field. And it does so taking into account the specific context of our region. In Uruguay, for instance, the ideas of the book, applied by Florencia, Nicolas, and the team, reduce school absenteeism and improve learning. The book contains concrete actions, simple tools to improve our behavior and that of society in such crucial areas as health, education, or saving. I would like to invite you to read the book and to listen to the authors. Thank you. Thank you very much to Ferdinando. And speaking of authors, allow me to introduce them. We've got Florencia Lopez once again. Many of you must know her. She has a vast track record at the bank. She's the lead economist at the Social Protection Division of the IDB. That's one of the areas she works on. This also includes a whole lot of other areas. She has a doctoral degree by the University of Oxford, and she also works for the Institute of Labor Studies. We have Nicolas Ajzenman, who is an associate professor at McGill University in Canada. He has become a better guy ever since he's gone off to Canada, and he's also an associate professor at JPAL. He's got a doctoral degree in economics and a master's degree in public administration and international development by Harvard University. He has extensive activities and very fun work as well. All of his economic papers and his blog is also his newsletter, actually. Do we have to pay to read that? Or is it still free of charge? Well, as long as it's still free of charge, I would like to invite you to subscribe. And again, back to the book. Ferdinando has already told you a bit about the book. And one of the interesting things, and I think this happens to us all, is a list of things we want to do and we don't get down to doing, which is very lengthy. I can tell about thousands of things I promised my family and never got around to doing. And this happens to us. Interestingly, sometimes we do know that we need to do those things, and there are little details that prevent us from doing these things. And there are little details that help us do these things. In fact, one little thing I had on my list of things to do 6 months ago was scheduling my annual medical checkup. And the other one was dental cleaning. I had canceled these things and had never got around to doing those two things. And when I was trying to find a few interesting ideas of things that I wasn't doing, I thought this was a great opportunity to call the dentist and the doctor to schedule my appointments. Isn't it interesting how a little nudge, which was prepping for this presentation, helped me finally deal with something that was still pending? And I guess the same happens to you. There must be a whole bunch of things that help you as well. So one great thing about the book has to do with the small details that make us make bad decisions. Having all of the cookies and brownies by the door encourages us to make bad decisions, but there are also little details that help us improve our decisions tremendously. So we'll talk about how the book deals with the way behavioral economics can help us do things in life. And for all of us here, it's interesting to see how by applying behavioral economics, we can improve the design and execution of public policies and thereby continue to improve lives in the region, which is our household motto. And to kick off the conversation, there will be another video that'll be a lot more interesting than anything I could say. Let's watch this video that illustrates the importance of details in decision-making. There are many well-designed social programs in which significant resources are invested, but yet they fail to achieve the desired impact. Why is this so? Because the decisions we take are crucial for the way a policy works out. And important decisions depend on small details. Behavioral science shows that obvious responses to complex problems are not always effective due to the biases in the way we think, perceive, and make decisions. Let's take an example relating to the healthcare sector. Out of a group with a high risk of heart disease, only a few really make a conscientious decision and go to the doctor. Others ignore the science. And of those who are aware of these issues, only half make appointments. And those who do finally go to their appointments include just a fraction that will follow the medical recommendations. Most of them will put off the required or recommended changes. The result of this is that despite the major efforts in terms of public investment, impact is limited, as we don't just depend on a behavioral change, but also on paying attention to the biases in every micro decision. In other words, details. These challenges are present in all social policies like education, gender, employment, and migration. Download the book, The Science of Details, and discover strategies to navigate them and optimize the impact of policies in a cost-effective manner in Latin America and the Caribbean. Excellent. Great video. Perhaps the first question we could already take and then leave a few minutes to talk to you and also see what comments or questions you have via Zoom. Florencia, we've been working on behavioral economics for over 10 years at the bank. We have a vast agenda, and much of that has been developed by those sitting here now and who've been instrumental in us having a group and initiative. And one interesting thing is that in over 10 years, we hadn't yet written a book like this one. And clearly, one of the leaders in this project is Florencia. She does research, but she's in an operations-oriented department, which is the social protection division of the social department. So perhaps the first question is how this idea first came up. And it's also interesting to consider how people are sometimes, doubtful as to how much the bank should devote itself to research work. We could provide some context as to why we do research on behavioral economics and why this work is important for the sort of work you do at a division like yours. Yes, good afternoon, and thanks to all of you for being here. Yes, for almost 15 years, I've been working on the design, implementation, and evaluation of programs in the social sector relating to healthcare, childhood. And one thing that has stuck with us, with our whole team, not just me, was that we wondered why it was so very tough and difficult to change behavior, as the video illustrated. Why don't we actually go and have a blood pressure taken when that can make a difference between living or not? 2/3 of deaths in Latin America are due to cardiovascular diseases and diabetes. These are chronic diseases which are also responsible for high morbidity rates in the region, and they also generate so much in the way of costs for the health sector in the region. And there are so many issues that arise if you don't deal with the risk factors, such as high sugar or cholesterol levels or being overweight. It's not just that these things haven't yet been solved in the region, but these things are on the rise. So behavior seems to be getting worse and worse. So this, in the social sector, made us consider that behavior had to be at the center of any public policy. And this doesn't apply just to health, also to education, labor markets, migration, not studying, not saving, not going to the doctor. This is also greatly correlated with poverty and can engender even more poverty and create a circle of poverty unless we reverse these bad decisions. Somehow, this book and the details we referred to in the book are what we in the social sector think is a responsibility for government and for an institution like the IDB. In other words, improving the setting for decisions. Those are the details. We need to improve on the architecture and structure for decisions in order for people and societies to be able to take decisions consistent with the long-term goals and with their well-being at the end of the day. That's the sectoral motivation. But as you said, there was already a behavioral economics group in 2018. Nicolas joined the team, and hence the importance of knowledge. We started to create a whole lot of evidence for Latin America. And this was a subject that had evidence pertaining only to developed countries until then. So the sectoral motivation related to the difficulty involved in changing behavior and considering the impact in terms of costs for governments, the nudges for us to change as individuals and societies in order to attain the desired welfare levels. That was the starting point. Absolutely great. And speaking of details, I'll share with you an example that you may find useful, or some of you may. When I joined the bank 23 years ago, there was the onboarding week, and someone from human resources came along and said, there's this accident insurance, which is very good, but it's optional. So, and of course, I said, this is great. This is what I want. I want to go to the gym. I want to go on a diet. Where can I sign? And he said, no, we don't have the forms here. If you want to take out this insurance, you need to go to the 4th floor. You need to go and talk to, let's say, Maria, and she will give you the forms. And I wanted to have that. I thought it was great, but it took 14 years to do that. The mere fact that the forms were not available then and there, and that I had to go to the 4th floor and meet this lady, prevented me from doing it for a long time. So this is why it is so important to consider the little details, the importance of the forms not being available on the table prevented me from making a decision that would have been very good for me. So sticking to details, it's almost counterintuitive. What difference would it make if a form is here or there? But clearly, it does have a great impact. And interestingly, people who are into marketing know about these things. When you go to McDonald's, it's obvious, but perhaps in the public sector, we haven't yet embraced that. Perhaps you could tell us a bit more about the details, the science of details, Nicolas, a bit more about the book. Yes. And you know, something came to mind. In the video, you would basically be the one who falls after the second step, right? I think it's a good example, the one you gave regarding Maria on the fourth floor, because at the end of the day, the point of the book is that most policies or programs that governments undertake obviously cost money, and they entail some more structural change, but there are many ways to do things, and they all cost the same. If the IDB had wanted people to take out the insurance, it had the program, which obviously carries a cost, and the cost is the same if Maria is on the fourth floor or on the first floor. But that tiny detail, which one would think is totally unimportant, is important because what's at stake, which is the long-term life and well-being of Carlos, should be more important than the cost of going up to the fourth floor. But it seems that is much more important, and the cost of going to the fourth floor for some reason or another. In fact, we go into an explanation of the reasons for that. Perhaps sometimes we have underestimated the impact of these details when it comes to decisions that can be truly important. So the notion underlying the science of details basically is a sort of wake-up call for us to pay attention to factors that we would normally consider unimportant, but which are not insignificant when implementing any policy. And the idea of something costing the same, whether you do it right or not, is what motivates the intervention. And Florencia, you did start talking about a few examples, and we saw this in the video too. Could you give us a few more examples of successful policies? How by thinking about these tiny details when we implement public policies or bank projects, we can make a difference? Yeah, I'll share a few with you, and if there's some more time or even during the questions, we can flesh it out. I, again, have my bias coming from the social protection division. My colleague Emma Iriata, I think I saw her there in the Mesoamerican Health Initiative, has been working for quite some time in Chiapas, where 12 indigenous languages are spoken. And with the Public Health Ministry, they're trying to do one very important thing, which is to save the lives of babies and mothers, because the rate of maternal and infant mortality is very high in Chiapas. And she shared this story, which is marvelous. I will repeat it here. You know, in one of the health centers, there was a project to adapt the materials to the local culture, to the languages. Also, the project intended to adapt the seats and chairs for women to be able to deliver their babies, and 12 weekly deliveries were expected, and only 1 or 2 mothers would come along every week. What had happened? It was the color of the walls, the detail. Emma told us, white, like any regular hospital or health center, white in indigenous cultures is associated with death. So how would they go and give life in a place associated with death? So we changed the color. Also, with this Mesoamerican initiative, we started working on child anemia. Anemia involves a low red blood cell count due to lack of iron. And if you don't deal with this early on, it may create a cognitive deficit and affect the learning of children. In El Salvador, the half of children that are in poverty suffer from anemia. So the project distributed micronutrients, a powder which is iron-rich, and this was delivered to 80% of eligible families. But 1/4 of the parents gave the powder in due time and manner to the children. This is revealed by the survey. So 82% had been delivered, but only 1/4 of the children gave this to the children, because the treatment is lengthy and complex. There are 3 cycles involved, 60 days. They need to eat the powder with a food, then 120 days break. Otherwise, the iron can be counterproductive. Then you need to repeat that 3 times. And mixing the micronutrient with the food requires a certain process. Children are not very fond of this. They resist it. And the parents have to deal with all of these complexities, even though they will only be able to see the benefits when their children eventually go to school. So with Pedro Bernal and Mariana Sanchez and the whole team, we started looking at this, trying to come up with a hypothesis as to why this could be happening. Was it that parents were forgetting about this? Were they underestimating the effect of anemia on the children? And after the many workshops and working in Panama, it became apparent that anemia is a silent condition. It's not visible in the populations. And now the data has come in, and it shows that raising the visibility of anemia, having it measured by using non-invasive means, could perhaps encourage parents to stick to the complex and lengthy treatment. One last example, we have more related to the education unit and the gender and diversity and migration units. But, a project here, a project there, might not have such a strong impact as when we conceive of this systemically by looking at the data, which is one of the reasons underlying the book. One thing we've seen and mentioned in the book has been the dissemination and spread of these units. And we actually launched the first 2 such units in the region. The idea is for the projects not to be conducted in isolation. We want coordination. Great. And going back to something we didn't mention earlier on details, so that you get the picture of how this impacts many areas. For example, another good example could have to do with the election and ballots. Sometimes we all think we are making very carefully thought out decisions. And in fact, there are some details that slip through the cracks. Yeah, this is not really that scripted, is it? I think one interesting point is how we make electoral decisions, how we decide who to vote for. There's this whole idea underlying the rationality of voting, how rational we are when it comes to voting based on performance. And one impression I got was that, especially when there are a lot of undecided voters, little details might have an inordinate effect when you actually cast your ballot. For example, if you vote in a school that is in poor condition with bad infrastructure, you're going to probably punish the incumbent, the one who's in charge of looking after the schools, which I find rather surprising. But of course, I believe in the results. After all, it's my work. And, sometimes we think we elect very rationally. And in theory, we have a whole lot of opportunities to judge the performance of a politician. In Argentina, for example, there was someone who had been the mayor for 8 years, public schools, the metro bus rapid transit system. And, sometimes the last couple of minutes when you go into the voting booth, that might light something in your brain that makes you change your mind, even though it's something minute. Yeah. And I remembered the paper because of the walls and the colored walls. It's very much along those lines. And there's something you also talk about a lot in the book, and something we do a lot of research on. By the way, yesterday I published a paper on this. Social norms. Clearly, we all care a lot about what others do, and also we care about what we think others would accept as far as our behavior is concerned. So our behavior is always affected by what others do. There are some highly positive examples of social norms, others not so much. For example, people working on gender issues. That is an area where we can see that very clearly. There may be social norms that lead to women not being duly integrated into the labor market, or to them not to pursuing STEM studies. You know, there's a long list of things we could think of. Interestingly, it's not just social norms per se, but also erroneous perceptions regarding social norms. We act in keeping with what we think the social norm is about, and in keeping with what we think the rest will accept. Again, there's an interesting paper on the work done by women in the Arab world. Men say that they would be willing to have their wives work, but that the rest of society would consider this inappropriate. And, you know, when you ask the men individually, they're okay with that. And when you tell them you're okay with this and everyone else is okay with that, then the share of working women climbs a lot. You could tell us a bit about social norms, where they come from, how they affect us. Yeah, actually, taking one step back as far as social norms are concerned, when we reflect on the decisions we make, ultimately, we do what we think will make us happier. But the things that will make us happier involve some unknowns. You know, I may study X because I think this will make me earn a lot of money in the future. Finally, I end up making a decision based on a perception regarding something that is an unknown. And if the way I form that perception is somehow biased, I may end up making a decision that doesn't serve my own interests. And social norms have to do with just that, because for some reason, I want to do something that is socially accepted, but what is socially accepted is no certainty, is a perception of mine regarding what others think and regarding what others think I think. So it's quite uncertain.
So this example that you gave us about the labor market for women in Saudi Arabia is excellent, but many others come to mind. How socially acceptable is it to not pay your taxes or to do something corrupt? I don't know. So I have to seek out some signal that would indicate to me what society thinks about that given behavior. And there are places where people think it's worse than in others to not pay your taxes. The relationship this has to what we were saying is, how does this reflect actually what is or is not acceptable, and the way we act based on prejudices or biases? We may do something wrong because our own perception is erroneous. So what do we do to improve people's perceptions? Well, we have to bring them closer to reality. This is true in the case of gender, but it's also true in many different areas, a number of which have been discussed in the book. So social norms are perhaps one of the most important points we raise in the book. I completely agree with that. Florencia, one matter that comes up, and I'm going to try to get back to the script I had thought about. So when we saw that video and we saw each of the different phases there. But first, we have the matter of the decision. As you were saying, you may understand at a logical level that you should be eating brownies all day. And then once I accept that if I want to be in good shape, there are a number of different actions I have to take to get there. Could we discuss this a little bit more? The associations we make, the actions we take, and how behavioral economics or sciences can provide us with some guidance there. As Nicolas was saying, that he loved the part about social norms, I'm going to talk about the incentives. We are all always weighing short-term urgent matters, and for some families, it may be getting from day to day. And then we have to weigh that against the long term. For example, sending our kids to school later. That distance is something that we need to, for matters having to do with savings. Okay, if I save now, 30 years from now, what will I have? And some of the reminders are things that have worked very well for people to go out and vote more, or to go to the doctor, or go to the dentist. But Mario Sanchez this year wrote an article on Uruguay for something as important as follow-up for cancer and a reminder to click here in an electronic calendar. It changes things overnight. So it's like moving from where I was talking about the births from 2 per month to 7 per week. So, it's something that's like we used to put up on a bulletin board, a little note saying, don't forget about this. And you can do that in Outlook, but reminders tend to improve results in scheduling and then going to doctor's appointments or kids and schools and university. But in Jamaica and Brazil, we use text messaging to ensure that people would read more and engage more. The example that Ferdinando raised in his video was important. We worked with the education unit, with Mateo, with Nico. In Uruguay, 1/3 of preschool children do not attend preschool every day. They go from time to time, and that's a problem because they learn less. We worked with the Uruguayan government to have a mobile messaging app to inform parents about the number of absences they had, and say that regular attendance would lead to academic achievements in the future. So that was helping to raise the issues with parents just through the messaging. And during the pandemic, every government wanted to make sure that people would go out and get vaccinated. At the beginning of the pandemic, it was a matter of supply. There weren't enough vaccines. But then there came a point where there were. In the case of Belize, we were working with Juliana and the Mesoamerica health team. Half of the population went unvaccinated, but there was supply for 100% of the population. And so we asked ourselves why. People were concerned about the safety of the vaccine. We sent messages, yes, the vaccine is safe. There were typical public health messages shared with the public. Then in Facebook, there were 2 links, one for people to feel rest assured that the scientific evidence was there to say how safe it was. And then there was another link, a single click to tell them where they could go get vaccinated, when they should do it. And that helped. So it's like what you were saying, when having to go to the 4th floor to sign the papers. I may very well want to do something, but just that little bit of information will help me make the final take the final step to do that. And so it's about take up. Something quite important where you work is with children and poor people and the cognitive overload. This happens to all of us. We may be, whenever we're tired, we make worse decisions. A few days ago, I had to buy some train tickets. It was late, and We had to make, stopover change trains, and I bought the tickets from, even though we arrived in one train station, departing from another train station. So this is what happens when we're tired. So when people are poor, they are more inclined to do that. You have to think about how to feed your children today. And so the mental capacity to consider other matters is just not there. How do we have to think about designing and developing public policies, taking into account the overload that many people in poverty are grappling with? Well, last week, we had the person who's basically the father of this type of studies, who turned 90 last week. And he was the one who talked about this single system, one that doesn't require much of an effort, and then system two, which does. And so when there's cognitive overload and you're grappling with poverty, that is a recipe for failure. This idea to have detailed units is what we heard during the Obama administration. There was a book published called Simpler. It's about simplifying life for the public. For example, in the case of applying for a scholarship to the university or to high school, or having to do with food in schools or tutoring. My colleagues are working on this to catch up from all of the knowledge and learning losses that happened during the pandemic, to make everything simpler. If we were able to do that, particularly for more vulnerable communities, that would help them to access public policies and social policies that would serve them well. So we need to have these units that would simplify access to public policies. I have more questions, but we have tons of questions that have come to us through the chat. So there's one from Lucia Maldonado, who said, how would you define or characterize the concept of a detail? Could we get a more formal definition of what a detail consists of? Then you should ask the economist. A formal definition, this may not be the place for that, but conceptually speaking, when economists think about what impacts a decision, we always consider, okay, if you have two options and with access to the same information and preferences and the same perception, so two individuals making the same decision under similar conditions, one would think they would make the same decision, because we think that's the way people make decisions, and that tends to be the case. If, however, I change the way that information is presented, I change the set of facts or the order in which the different options are put forth, which detail is going to become relevant based on that decision-making process. Those are the types of factors, it may be seemingly relevant facts, refer essentially to that. The reason for changing a decision may not be one of these seemingly relevant factors. Something that I liked in the book, we talk about if you consume fewer calories, you can lose weight. So in restaurant menus, you may have the dish and the calories. Now, if we put the calories first and then the dish and then the price, you may choose dishes that are lower in calories, even though the information didn't change, the price didn't change, the ingredients didn't change. And that's what we talk about when we're talking about details. If anyone in the room would like to ask a question, we do have microphones. If I see anyone stand up, I will call on you. Something that's very current. And I was going to ask Florencia this, but I can add, if there any experience with the dengue prevention campaign and in looking at ways to handle that. So how would you respond in terms of this? Okay, well, health is my area of expertise. I traveled to Brazil on mission, and that is where dengue is endemic. It's one of the places. We're going to talk about using sun protection, which is it is a very typical thing when we talk about behavior change. Okay, every 2 hours you have to reapply sunscreen, and in doing that, you can prevent sunburns. The same is true with repellent. If you go into the water, you have to reapply it. And dengue, we talk about spraying, climate change, standing water, rains. There are many structural factors at play, but individually, it's about wearing sleeved clothing and applying repellent. So these are preventive behaviors that we encourage. May I add something here? I like the example to speak ill of our book because people aren't going to change because of a single detail. There may not be repellent. That's life. Look, I'm not trying to detract from our book. It's an excellent book, but there's no silver bullet, either for this nor for anything in any of for any solution to any global problem. But I completely agree with everything that Flor just said. And for many years, that was part of the problem. But there are certain things that have absolutely nothing to do with that, and they're more structural in nature. There's no way we can perform magic to make a change. Well, first, congratulations. I love to see the fruit of so many years of work. I'm pleased to be at this launch, and my congratulations to you. I was struck by something you said, Flor, about these nudge units in countries. We have to make things simpler for the public, for individuals. So why do we not do that? Why don't policymakers make things more simple, not just for them or the bank? It's an excellent question. Policymakers are often bound by ministerial decrees, process manuals, laws. Those of us who work in this area know that, there are hundreds of thousands of pages of manuals of how you're supposed to put these policies together. It's never really a focus on how applicable they will be or how hard they will be to implement. Look at down the street with the prime minister and saying, everything you're doing, everything wrong. People can't access health or save money, recycling, tax payments. So the change has to happen here with us. And I think that's why these behavioral science units and nudge units are important, because they return the ball back to the other side of the court where you're looking at all of the legal side of this. Do we have to read every single page of this, yeah, that's fine. You need to understand what the laws are and the regulations are, but there has to be a way to simplify it. It's kind of the second generation of behavioral sciences and behavioral economics, and like nudge. And this happened, it began in England, but it also fell under the Obama government. The delivery units, which are the government agencies that are in charge of this. It's about the quality of the government. It is entirely tied to those. I agree. We have so many areas that we don't even think about how this is going to impact the future. We can't just sit here and criticize governments. You know, they will publish the law, they send it to you, and then we can have a compendium of laws that we read every day, and that could help us understand how to behave, but it's not going to have an impact on changing our behavior. And we do the exact same thing at the bank. All of those who work in operations are really going to have to read this book before too long. There was another question I came across here. And this is something that's come up in a number of questions. I'll recap those. Given your experience, if we look at education and think about behavioral economics and can help make improvements to education policy. This is fertile ground. There's quite a bit of fertile ground for that in this area. I see many of you here who work in education. There were a number of interesting examples, and I'll try to sum this up and make it less abstract than what we were talking about before. In Ecuador, one of the objectives was to reduce teacher sorting. That means that the best teachers want to work in the best schools, and rural schools were at a loss. And worked with many people here. We conducted an intervention in a website where they had to select the schools they wanted to apply to work at. So we picked some of the more difficult schools at the top, and that's how things generally work in marketing. You put the most desired at the top. But so we added a question. We weren't hiding anything. We weren't withholding any information. There were no financial incentives at all that you might think would have a direct impact on the incentives or the decisions or the way we think that we make decisions. What we did was we made a change in the placement, and that had quite a great impact. And it was part of the entire education system. Many of the decisions we make, what to study, when to study, where to study, in many cases, they are tied to factors we haven't even taken into account. And so the decisions tend to be affected by the biases that we discuss in the book. And in a number of questions, people are asking about how do we put this into operation? How do we incorporate these tools into policy making? What the methodology that you followed and that we follow at the IDB in terms of a diagnostic analysis? How do we take this from theory to practice? In behavioral economics, it really departs from traditional economics and pairs up a little bit more with sociology and social sciences. In public policy, we were seeing that happen, But in many other areas, they never tried to determine why 15-year-olds decide to drop out of school in this area, in this country, in this region. Why? Because school gets harder. They're less interested. In the book, we look at the positive and negative side. Well, it's like the dengue case. So it's a small change, but on the adverse side, we have to understand why the parents were not giving the kids that iron supplement. They don't know how to do it. There are thousands of reasons, and we have to try to understand them. In the book, in our approach, we use lots of surveys, lots of site visits, focus groups, and we have hypotheses. We try them out, we test them out, we see what the results are, and then we rework them. In Jamaica, in working with the text messaging, we figured out that it was better to send the text messages at 10 in the morning because the parents have time to read it, but at 6 p.m. it's not a good time because that's bath time for kids. And so, they don't have their phone there, they don't want it to get wet. There are other conditions that prevented them from reading it. So we tried to be very active and approach each of the cases. Sometimes you can, sometimes you can't. What Florencia was saying is key because it's not just conducting the analysis, knowing that a message needs to be sent. It's when, how, what means of communication are you going to use to convey that message? So it's important to conduct pilots and then work from there. We have a question in the room. Good afternoon. This is an excellent topic. I think it's fascinating how behavioral economics works and converges in studies of individuals. I noted down some issues that we have to find ways of collaborating on the side of engineering as well as behavioral economics. I call it the principle of friction reduction, like in the case of the forms that you had to sign on the fourth floor. This, to ensure that these systems flow, we have to look at the way we're presenting information alternatives to do that. We talk about this in engineering. How can we ensure that we're giving people the context that they need to have to understand what's going to happen in the future? We call it remembering the future, what they have to do now to ensure certain results in the future. And during a system design phase, as part of the user experience discipline, what's important is to empathize, to actually put yourself in someone else's shoes. But it's not just putting yourself in someone else's shoes, it's putting yourself into their cultural setting, their understanding their socioeconomic position. This brings us closer to the human experience. So I was wondering if you've considered a multidisciplinary exchange with other departments on this very matter. Yes, thanks so much for that comment. Something that we always do is look at the digital agenda and behavioral economics. It's dynamite. It's a way to scale this up. And this is something that we do discuss in the book. We are certainly endeavoring to work with ITE, other departments. I would be very pleased to continue this conversation with you. Unfortunately, we have to wrap up, but I would like to ask one final question. What the gentleman raised is important. We're at a time of revolution, the digital revolution. We are going to be able to do so many things that we couldn't do in the past. AI, sending reminders. Okay, before we would have to send letters. We never knew when the letters were going to arrive. Now we can send instant messages. So just to wrap up, I would like to ask you what your thoughts are about the future. Where do you think we're going to be in just a few years in this area? I'm thinking about digital tools and a little bit about AI and the role it will play. Let me respond this way. I have two thoughts. One will be more general and where behavioral economics is moving. I believe there was a boom at one point. It became very trendy. It was kind of cool, as happens with many other things. And we started to see a lot of really entertaining aspects to this. And people talked about, oh, we don't know why this worked or didn't. We start thinking about experimenting, and it can be very easy. You can see things changing from here, moving forward. Much of this reached its peak, and then there was, to a certain degree, backlash. It may be interesting, but certain things weren't working. I'm hoping we've gotten past that, and now where we've landed is somewhere where, okay, may not be as fun or entertaining, but it's quite useful. It's something that we need to replicate. It's theory-based. We have to connect it with other theories, things not that we're pulling out of the ether. This has a theoretical basis, and I think we are moving in that direction. Even in academia, you have to have the theoretical foundation to be able to publish. In terms of artificial intelligence, we are considering projects with some of you here in the room. There are some projects underway where AI would allow for scaling up, which could be difficult or even worse without it. We have an intervention, and we have young people, but we have bots of older people or some less intelligent people, and now they're learning, they're being able to be trained, they're much more similar to actual people. I think there's something there. There's a lot of space, not just for behavioral changes, but things not even necessarily directly related, or scaling up things that would have been impossible or more costly in the past.
So we're already running out of time, and I'm getting bad looks. Anyway, just 3 final announcements. One is very much related to myself. There's a course on behavioral economics. It is online and free of charge. We produce it at the back. You can see videos with Florencia and others. I do recommend it. It's on the IDB website. And of course, for those of you who'd like to read the book, you can download it, buy it, and ask for Florencia and Nico's autograph. And finally, there was a QR there inviting you to provide feedback on the event, also for those of you online. So we'll just close here. Thank you to all of you. It's been a very pleasant time shared with you, having a chance to talk to Nicolas and Florencia. And thank you very much to all of the team backstage helping make this happen. Thank you. Goodbye.